Hey, welcome back. The summer was great.
Right. Are you a sun worshiper?
I do admire the sun. I don't worship it. And I'll tell you one of the reasons why, because quite frankly, I think I look better with the tan. It conceals blemishes. I don't know, I just...
A lot of people feel better with it. I mean, and you know, there is some talk that, 20 minutes of sun a day is great to get your vitamin D, and it's all good for you, but it can cause some damage.
What about 2 hours with oil and those little reflective mirrors? Remember those things?
The days.
Listen, a lot of people overdid it in the sun this summer. We are joined by a couple of guests who are going to help us kind of reverse, perhaps, some of the damage that we all did, many of us.
Without, too invasive.
You're looking at Dr. Yael Halaas. She is a facial plastic surgeon. And also we have Phyllis Cunningham. I believe you are the patient in this case. But let's start with the doctor. Doctor, you have some techniques. By the way, we're not going to operate on anybody, right?
We're not operating today on anyone. We're just discussing 3 very simple, rather relatively inexpensive things that you can do to reverse some of the sun damage from this summer.
Okay, so a lot of people think that you have to go under the knife. You don't have to go under the knife.
You don't have to go under the knife, and more people are choosing these minimally invasive options. So some of the things that we were discussing today, one very simple thing that you can do to just kind of, even if you're in the sun for 20 minutes, that sun damage really penetrates in, makes the skin look dry, gives us all those brown spots we don't like. So chemical peel is a very nice, a superficial chemical peel.
Sounds not nice.
So the chemical peel, does it
thing.
really peel off your face, or do you have to be out, out of work? And
well, it depends on how deep you're going. So for a superficial chemical peel, which usually is relatively inexpensive, or maybe $150 with your licensed esthetician or dermatologist or plastic surgeon, and it can really take away some of that damage.
Let's meet Phyllis Cunningham. How was your summer, by the way? You look great. I don't see any issues, but were there some?
Work, yeah.
What?
Well, so for Phyllis, we did a couple of things already. We did our chemical peel, and we also did something called Dysport. A lot of people have heard about Botox, but Dysport is an alternative. And you can see...
We're looking at pictures right now. So what do we see on the left and the right?
The before and after.
This is the peel.
So before, you could see her skin was looking kind of sallow, kind of really lifeless, and her skin looks in the after is looking a lot more brilliant, a lot shinier, and a bit smoother as well. The other thing that we did for Phyllis is we did the Dysport, and the Dysport takes about 1 or 2 days to kick in.
There's that smile. You look so much. I like that.
So where did you put the Dysport?
So we did the Dysport in a couple of different areas.
Quite frankly, you looked happier before the Dysport.
Shush up here. Where did you put the Dysport?
Well, we did the Dysport for the frown line.
Okay.
And if we look at Phyllis, we can... Phyllis, frown for us. Can't do it.
She doesn't do it anymore.
So we don't have as much frown line as we did. And you really want to jump on this before the lines get too deep, because once they set in, then we have to chase it with fillers.
Okay. All right. We're going to hold that for a second. We're going to take a quick break and come back and finish this up.
Okay, great.
All right. Great ideas. We're back in a sec.
You ready for surgery?
No, she's not going under.
I think that's